This week, NephCure has been highlighting mental health and awareness, along with some health aspects around mental health and living with a chronic illness. So today we thought that we would bring on a couple of patient and a couple of caregivers to include Kelly, and just have a chat about what it's like and how we have learned to, and how we are continually learning how to cope with mental illness, and the different ways that that has affected your life and even your family's life. So just to get started, one of the themes this year around Mental Health Month centered around these ideas of breaking the silence, breaking down the stigmas that are related to mental health. The idea around this talk is that we hope that by offering an open dialogue and sharing our stories, that more people will not only realize that a person's mental health care is just as important as those medications that you take, but you'll also feel empowered to know that you're not alone. So with that, I'm going to get started, and I would like for our panelists to introduce themselves. We have Will Wellman from Tampa, and we have Kate Brooks from Colorado, and of course Kelly Helm. Most of you are probably familiar with Kelly, but Kate, do you mind introducing yourself first, and then we'll go to Will.
Hi everybody, my name is Kate Brooks. I have a 9-year-old daughter, Tegan, who was diagnosed at the age of 3 with FSGS. So we have been living with her chronic illness for just over 6 years now. And it's been a roller coaster for sure. I know a lot of other parents say the same thing, and I'm sure adult patients would agree. Kind of comes and goes in waves, I guess, as far as how we cope and the bumps in the road and how we deal with it. But happy to be here. Thanks.
Thanks so much. Will?
Hi, my name is Will Wellman. I am a FSGS patient, and I was diagnosed 12 years ago next month. And I've actually been on dialysis for 10 years as of March. And so, yeah, I've had a journey of unfortunately kind of bearing the brunt of no treatment, no cures, and having to deal with that in the form of a failed transplant. Well, not a failed transplant, a recurrence in the transplant, and then a decade on dialysis.
Kelly, would you like to say anything?
Sure. Hi, everyone. I'm Kelly Helm. I work for NephCure from my home office in Colorado. I'm the Assistant Director of Patient Advocacy, and I get the privilege of talking to patient parents and patients every day. And I also have a 14-year-old daughter, Macy, who was also diagnosed with FSGS at the age of 3 and kind of had a pretty aggressive form, received a transplant at the age of 5. And we've been living this journey for 11 years next month. So Will's got us by a year. So I'm happy to be here.
Thanks. I appreciate all of you being here. We're just going to go ahead and get started. Have a couple of questions to ask each of our panelists. So Will, I'm going to get started with you. Coping strategies are behaviors, thoughts, emotions that help you to adjust with the changes that occur in our daily life. What would you say if you were to give me your top 3 coping strategies that help you get through maybe some tough times, or when you're dealing with the stressors of living with a chronic kidney disease? What would they be if you were to give me the top 3?
Well, I think for me, it's things that keep me active, and that helps get my mind off things. I mean, I think living with a chronic kidney disease, and this is something we could all attest to, is something that you don't get to escape from, but finding breaks from it are nice. And so for me, exercise, time alone, and hobbies. So I like to kayak and bike. and that kind of physical activity is nice for me to just kind of get away from everything. Time alone is really important. As much as family and community is important to me, I feel like I do need my time to just kind of decompress and be by myself. And so that's something I'm not good at, but I try to prioritize it and make space for it. And then hobbies, I think, everyone's got hobbies, but I find for me, integrating those in a kind of routine pattern helps with just the mental health aspect of dealing with the kidney disease, as well as just physical health as well. And for me, that could be cooking or baking or writing or reading, just random stuff that I like to do. So
yeah, I think that's important. I think exercise and getting out, fresh air, camping, biking, like you said, I think those are all really important. I know when you exercise, you are releasing natural endorphins, and that will obviously help someone's mental state, as far as if they're suffering from a little bit of sadness, depression, that sort of thing. So that's a great point. That's a really great point. Kelly, there seems to be a disconnect in healthcare and communicating about mental health and chronic illness. I know that whenever, as a patient parent myself, I know that mental health doesn't seem to be brought up in any of our nephrology appointments. If you were to write a letter to yourself 11 years ago, looking back, right, and thinking about talking to your younger self at the beginning of this journey with FSGS with Macy, what would you tell yourself about mental health and well-being, and what do you wish you had known when your journey began?
Yeah, so looking back, I wish that I would have been made aware of the stages of grief that go with a chronic illness and how those are processed, and then also how those differ among family members. I think that would have made a lot of situations a little bit easier. Maybe a little bit more grace would have been provided had we been aware as a family of what we were all going through individually and as a family unit. The other thing is that I don't feel like you said, mental health wasn't really brought up until we were well into our first year of diagnosis. And Macy had been on high doses of steroids, 30 milligrams or higher, for about 6 months. And she was very depressed from the medicine at the age of, I guess she was 3.5 at the time. And at the time, it was brought up, but then it wasn't followed up upon. And then at that time, everything kind of got out of control. And we started with, weekly, bi-weekly, 3 times a week, and then daily albumin infusions. We were in and out of the hospital constantly. I mean, I feel like we were living in a triage zone. We were always triaging something and dealing with one emergency after the other. And so that got kind of placed on the back burner. And I wish someone would have told me when Macy was first diagnosed, you need to get in to see a therapist. Everyone in your family should get established with a therapist, whether you can go on a regular basis or an as needed or an emergency basis, but just to get established with someone. And then also someone to help us proactively process what we were going through. Because something that happened with my family is that we were in this crisis mode for almost 2 years straight of one thing after another. And there was no time, I thought, to process everything that we were going through. There was no time for Macy to process all of the medical trauma that was happening to her body and all the interventions. And then once she had her transplant and finally went into remission about a year post-transplant, all of those burdens landed on our shoulders, and everything that had been internalized was starting now to come up. And we had a lot of PTSD, a lot of unresolved issues that we didn't have time to even process before. So I wish that we would have had someone on our side actively encouraging us to process things as we were going through them. So if we had an emergency and everything ended up okay, I wish I would have taken the time, you know, that week or that month at least to process, to go back through it and say, okay, here's what actually happened. Everything ended up being okay, and just to work through it. And with Macy, if she had a long hospitalization where she had, you know, 8 pokes to get an IV and 5 people holding her down, I wish I would have had somebody come play that out with her and talk through that, just to kind of stay on top of our emotions and what we were going through. So that's one thing I would do differently, is seek help sooner. And even if you feel like you're doing okay in the here and now, it's always good to just kind of start that process and be more mindful of what you're actively going through.
Absolutely. Thank you for that. Kate, let's talk about family mental health. You know, chronic disease and being diagnosed with, you know, a progressive kidney disease can really cause some distress emotionally, mentally, for, I think, the whole family. And it might even, you know, relate to some impaired ability, you know, of the family to adapt to situations. How has your daughter's journey affected your family's mental health and wellness?
I feel like there's different answers to that question, but just looking back, like I said, Tegan was 3.5 when she was diagnosed. Her older sister was, let's see, she would have been 6 or 7 at the time. She had a really hard time with it. And, you know, we knew it at the time. We could see that she wasn't getting enough attention. You know, our daily decisions and activities revolved around Tegan and her health. And they still do, but we had a hard time just explaining to Avery, her sister, what was happening. And, you know, she was almost kind of jealous of Tegan's condition because there was so much focus on her, that we had a couple of periods of kind of some tough love, like, you know, do you want to go to the hospital and get poked? And it was a hard balance because Tegan was so young that when she was in the hospital, it'd be like, oh, like try and make it light, like we get to do a sleepover in the hospital, but then turn to her older sister and say, you don't want this. So that was a constant battle. And through the years, I think the whole situation has just forced her older sister to probably mature faster than her friends. I guess just accept, just like, you know, Jason and I have, that this is the way it's going to be. And like I said earlier, just kind of deal with the bumps in the road. But we've all have sought therapy in different ways. Tegan does play and music therapy every week. And for, I think, probably 2 years, Avery was in some form of therapy too, because she would almost parallel like situations that Tegan was going through when she was on high dose steroids. And then kind of similar to Kelly, we didn't go through what Macy did the first year, but being diagnosed with post-traumatic stress disorder at the age of 5 was kind of shocking for all of us. And similar to Kelly, I wish someone had told us that to almost expect that. But so we all kind of dealt with changes in behaviors and going back to school and being different. We all, I think, dealt with it in different ways, but did find help So Jason and I both, I get help with medication. Jason's gone through counseling. It did help Avery, I think, the first couple of years. And then she just kind of said at one point, like, I don't think I really need this anymore. So, she's 12 now and trying to deal with her own like preteen issues, I guess, but it's still, everything revolves around Tegan and her health, especially now with everything we're dealing with. We've always been strict and have taken precautions to keep Tegan safe, and now more than ever. So we've, isolated and we haven't even seen family members outside of our own household family. And we can see that that's taking a toll, especially for big sister, who sees friends are starting to hang out with each other. And she flat out tells them, I can't because of my little sister. So yeah, it's tough, but I think, depending on the situation at hand, have found ways to cope.
Yeah.
And get help.
Yeah, there was a question that's come in through Facebook, and I think that I think any of you could actually probably help answer this. It's referring to like an older sibling, or I want to say probably any sibling. Through this journey, being that you all have siblings, or Tegan's sister, Kelly, Macy's brother. Have any of the siblings ever been worried about the patient, right? Or, Will, your brother's worried about you to the point where they almost are into a point of anxiety. Have y'all experienced something like that?
I'll answer first since I'm not muted anymore. Yes, for sure. Avery was, like I said, like 6 or 7 when Tegan was diagnosed, and there were so many unknowns. I mean, we had no idea even what the diagnosis meant at the time. And every time Tegan ended up in the hospital, it was a question for Avery and for us, but we just had to kind of be the strong parents and try and be optimistic about everything. But yes, Avery has verbalized before, like, is she going to die? And we, even now, and Tegan asks herself, like, if I get coronavirus, will I die? And they're hard answers or hard questions to answer. I'll let somebody else talk, but yeah, it's a very real, stressful thing to try and come up with an answer for that.
Will, how have your siblings dealt with what you've gone through, and have you seen, this impact their life in a stressful way at times?
Yeah, I mean, I think it's affected my entire family system. Obviously, both of my brothers were in college and graduated when I first got sick. And I think there was kind of like a novelty to it at first. I was actually diagnosed with minimal change disease originally. And minimal change disease can be cured in some cases through steroids. And unfortunately, I had steroid resistant minimal change. And so our kind of journey was one of hoping things would get better, and it was just kind of downward. And 9 months later, I had a second biopsy, was diagnosed with FSGS. And by that point, they were saying you need to start thinking about dialysis in the next couple of months, or in the next year. So I think my brothers were kind of watching this from a distance. One of them was actually living in Micronesia, of all places, when my mom and I did a transplant, and he actually flew home for that. So I think what they experienced was this kind of journey from a distance watching it. And I mean, I think that brought its own host of anxieties in itself, because they're not there to see what's going on. And I mean, anyone in this community can know the shock of seeing someone that's you know, got edema and fluid retention. I mean, I was carrying like 55 pounds of fluid at one point. And so they would come home and it was like a shock to see me. I think my mom, who I was living with when I first got diagnosed, I just graduated from graduate school and was supposed to be going to Africa when I got diagnosed. And so I think my mom dealt with it the most. And now, you know, 12 years later, it's my wife who deals with that. And so it's very different though for my mother and my brothers. It was watching and all the unknowns and the hopes of all these medications that ended up not doing anything. And now my wife is dealing with the pressures and anxieties of just dialysis and the ups and downs that go with that.
Thanks. Kelly, what about you? What about your son and how he's handled Macy's illness all these years?
Yeah, so my son Max is 2 years younger than Macy, and he was maybe 18 months old when she was first diagnosed. So he doesn't really know any difference, but it has definitely affected him. He's more or less the more anxious of my two children, at least outwardly. And especially when things are not going well with Macy, he struggles. If Macy's in the hospital and he's at school, it's a long day at school. He's back and forth to the office just to get reassurance. We've, you know, had to make different plans of action throughout the year where he's able to call home to check in and see what's happening. Just the unknown for him and not knowing what the plan is. He's a big planner, I think, because of the way he was brought up. And we were in and out for a while. Macy and I would be home for 2 days and back to the hospital for 3 weeks, and home for 12 hours and back to the hospital. So, and that has caused him to be kind of an over planner. And so you see the anxiety affect him in different ways than Macy, but almost more so. It's difficult. And again, the difficult questions. Why don't I have kidney disease? Why does Macy have to take that medicine? So it really has affected us all, like Kate said, in different ways.
Yeah. I have to say, Logan will have been diagnosed 4 years this summer. And when he has relapsed or has been in the hospital, not feeling well, that sort of thing. I know him and his brother, they share a room, and my husband and I will find that they have, you know, they'll sleep together, you know, like it's this comfort thing for his older brother to want to be with him. And I think they comfort each other, you know, but we do find that whenever Logan isn't feeling well or after hospitalization, there is like this need to like grasp on, you know, and so we have seen that. Will, I'm going to come back to you with another question. You know, if you think about your journey and you're, you know, going through, you know, dialysis and transplant and then a dialysis obviously again, how do you think that your journey and the experience of, you know, dealing with emergency health situations, you know, medical interventions, you know, I mean, if you think about this journey, right? How do you think that this has affected your mental health? And do you think there's lingering effects, how you handle stress with living with a chronic illness?
That's an easy question. Yes. Yeah, I really sympathize with what Kelly was saying earlier. When I first got diagnosed, I mean, I had kidney failure within 18 months of diagnosis. And I just remember then being so different than what I'm going through now. And for me, then it was just kind of go, go, go. And it was just like I was caught up in like, all right, we're going to go to this doctor appointment. And like I said, I just gotten out of school and I wasn't working at the time. And so my whole life revolved around my illness. And I wasn't in therapy then. And honestly, like, I thought I was in a good place because I was just so busy with dealing with my illness. And then after the transplant and the recurrence, I mean, they put the transplant in and took it out a month to the day later because I had such aggressive recurrence. but after that, I went back to graduate school. And so there was this whole thing of like being sick for 3 years, and now I'm at graduate school. And so there was kind of the novelty of that. And so it wasn't until like 6 or 7 years after my initial diagnosis that I really started having mental health issues. Anxiety and stress being the predominant ones. A lot of that is kind of like having a mental, having a chronic disease and trying to work full time and have a family. It's just a lot, and it just like wears me out. And so like there are days when I just feel like I can't take it. And so that's been one of my biggest issues, is trying to kind of juggle all of those things. And then I think the other is kind of like Kelly was talking about, this is like processing these traumatic events that happened for years, and then it was like they all of a sudden came. And for me it was literally like 6 years after diagnosis. And so I've recently started therapy in the last year. I'm stubborn and stupid sometimes, and so yeah, I would advise anyone going through this, whatever your experience of it is, to seek counseling, because it's a great thing. And it's not going to hurt you, right? Unless you have a terrible counselor. But no, it's a good thing. And I wish I would have done it earlier. And I just like personally, like I was 25 when I got diagnosed, and I was like in the best health of my life, and just, you know, kind of no concerns. And so to deal with your mortality and illness, and just a completely different trajectory than I was on before, was a lot. And I didn't process it in the way I should then. And so I think I'm feeling those effects now.
I think you brought up a good point, Will. I think just even talking that it took you, several years to really decide to seek help. I think there's a vulnerability to that, and I think it's real. And I think that's one of those, I want to say issues, one of those things that we're talking about today. To hopefully, by seeing, and hearing these stories, and what your experiences are, that others will realize the importance around it. So I appreciate you opening up about that, because I think it's just the real life, that we deal with. So I know that Kate spoke a little bit about the, therapy, the professional care that you and your family has sought out. Kelly, can you tell us anything? What kind of therapies maybe Macy or you or any of your family has sought out, and how has that helped you guys?
Yeah, sure. So Macy has been in a multitude of different therapies. She's actually done play therapy, music therapy, talk therapy, art therapy over the years. And the one that we kind of added that has been super beneficial, but kind of surprising to all of us, was massage therapy. And she actually does it at her therapy center. And one thing that we had realized once she started massage therapy is that her body had forgotten how to relax. And so once she had retrained her body how to relax, it was amazing to see how that affected her mental health and physical health. And then I've done EMDR therapy, which uses eye movements to recall traumatic experiences. That was very beneficial to me to work through some PTSD I had through a couple of different emergency situations that we had been through with Macy, and talk therapy. And then also Max has done play therapy as well at the same therapy center. So it's kind of nice because the therapy center gets to know your family and your situation, and they can really help work through the chronic aspect of chronic disease. The goals are different. You're not, you're still goal oriented, but you're not trying to get done with therapy, right? Because the illness is never going to go away. So it's more of a long-term treatment option for us.
Yeah, I think that's a great point. It won't go away. And so I think by opening yourself up and your family members to therapy, I think you have to find the therapy that matches the person and what's going on, right? And so I love that you mentioned even massage therapy and art therapy. I think those can be other great options. I think sometimes people really are just thinking about, you know, sitting in an office on a couch or, you know, and just talking. And that is, obviously, that is quite productive as well. But there are other types that can really help people. And then, like Will talked about his coping strategies earlier, sometimes as you go through therapy, you might realize there's a different coping strategy that would really help. And, you know, or even, you know, meditation practices, you know, those grounding or those centering, you know, exercises that people do to really try to get themselves to a more calm state and to refocus on what's going on. So we had a comment on Facebook from Medinia. She said that her daughter was diagnosed 10 and a half years ago when she was about 2 years old. She's currently in remission now for 10 months with no meds. She's definitely dealing with the burden and feeling the effects now that she's in remission, that they're no longer in that triage mode. And she's been struggling with how to help her. So she says, I really appreciate all of you sharing your stories. And then Sarah has asked, Kelly, what kind of therapy center is that you were referring to that offered the different modes of therapy?
So Kate and I actually take our children to the same therapy center, just different locations. And we actually drive an hour and a half to get to therapy. So we go twice a month. We drive from Colorado Springs to Denver. We're very fortunate, but it's actually a therapy center that is structured to treat chronically ill children and their families. And it was designed through a Medicaid waiver for children with life-limiting illness. And I'm sure that there are other therapy centers similar to it across the world. So I would definitely look into that. Look into your area if there's a therapy center that frequently deals with people dealing with chronic illness, because it is definitely a different approach to therapy in adults and children and siblings and parents. So, but that's not to say that you can't find someone in your local area that can help you. I would just advise that you're very upfront at the beginning. Listen, we're dealing with a chronic illness. This is not going away. This is something that we have to live with as a family dynamic, and it's not something that we can recover from. So,
yeah.
Anybody else?
Yeah. Anyway, thank you, Kate and Will and Kelly. Thanks for joining me today. As we close, I just wanted to thank a couple of our sponsors today, Retrophin, Apellis, and the Pfizer Foundation for helping us fund programs like this and bringing mental health awareness to our community. I think we're just beginning to really talk and share information and really expand the NephCure mission as far as enveloping mental health and wellness into our education. So I appreciate you guys being here today. As always, you can find us at nephcure.org. You can always email Kelly or Kristen. We're happy to try to set you up with any resources that you need. Kate and Will, thanks so much for being here. We appreciate your time, and I'll be back with Nurse Kristen in a couple of weeks. Thanks so much, guys.